Namaskara, good morning. I am Dr. Anjali Balachandra. I am a general physician here at Maarga Mind Care in Bialahanka in Bengaluru in India. I have lived and qualified from England. So Down syndrome is a genetic condition where people with Down syndrome have an extra copy of chromosome 21. So people usually have 46 chromosomes, 23 pairs of chromosomes. But on chromosome 21, instead of having 2 chromosomes, people with Down syndrome have 3 copies of chromosome 21. Babies around the world, 1 in 1,000 babies will be born with Down syndrome. That is the same all around the world. In terms of hereditary, 97% of people with Down syndrome is just by chance. There is no reason. It's like some flowers have 5 petals, some flowers have 6 petals. It's just by chance. There is one type of Down syndrome, which is very low percentage of people with Down syndrome, 1 to 2%, called translocation. This translocation Down syndrome can be hereditary. However, the main people who have Down syndrome just have it by chance. In terms of causes of Down syndrome, like I said, there's no particular cause. We don't know why it happens. What we know is this chromosomal variation, this extra copy of chromosome 21 happens very early in the pregnancy, and even though they have the extra chromosome, the baby, the fetus survives, and that's why we have people with Down syndrome, because chromosomal variation of having the extra copy of chromosome 21 still makes the baby, the fetus, fit enough to live, survive, and be born. So Down syndrome can be detected during pregnancy. So usually around 10 to 12 weeks of pregnancy, women are offered combined screening. Combined screening is a blood test, and the blood test looks for the chance of Down syndrome in pregnant women. The normal amount of chance is usually in the range of 1 in 30,000. So like myself, my result came back 1 in 100. That is considered high chance. Then after that test, I was offered amniocentesis, which is going into the tummy to take a sample of the amniotic fluid. Chorionic villus sampling, again going into the pregnant lady's tummy to take a sample from the placenta. Or what I had was prenatal non-invasive testing, which is a blood test. In my blood test, they looked at my baby's genes and gave me a result of 97% chance that my son will have Down syndrome. So that is during pregnancy, Down syndrome can be detected. The other way is postnatally, after giving birth. So after giving birth, many women and parents and new parents and doctors may see some of the features of Down syndrome in the newborn baby. So it is a simple blood test looking at the genes of the baby to test to see if that baby has Down syndrome. By the blood test can see the extra chromosome number 21. Parents, families, the research is really positive. After our son, we have 2 girls, twin girls, and research shows, we are living proof that people who have family members with Down syndrome consistently say their lives are better because of their family member with Down syndrome. In our family, Dexter, he has made other people's lives richer and full of joy and love, more laughter, more love because of that. But it is important to remember it is still different. So there are more appointments, more concerns, more health concerns, and there is an element of grieving for the child you imagined you might have compared to the child you do have. So parents do need help, they need support. They need awareness. They need to be proud of their children. They don't want to receive pity. Please stop the pity. What do they need? They need support. They need love. The parents, the family, the carers, the extended family, acceptance of this child, but also not just accepting, enjoying the child. So looking after the parents' mental health, looking after the financial needs, looking after other aspects of care for this person with Down syndrome and the impact that has on the whole family. Generally, like I said, people are consistently say that their lives are better because people with Down syndrome are in their family. So when they are growing up, children with Down syndrome, like I said, we are living in a very auditory world, okay? And to auditory process the information can be tricky and it can be difficult and it can be tiring. And children with Down syndrome are visual learners, okay? So there are therapies. First of all, for communication, speech and language therapy, there are visual aids, literally pictures, PECS, augmentative communication strategies. And then other therapies, occupational therapy, physiotherapy, vision therapy, play therapy. There are many, many types of therapies that the parents can learn. The point of the therapy is to empower the parents and the family to give them the skills to provide the therapy for their child daily. Repetitive therapy, repetitive exercises, these are the things that will make the biggest difference. So children with Down syndrome also have increased chance of some health conditions. But we must remember, even neurotypical babies, neurotypical children, when they are born, we can't predict who's going to have what problem in the future. The advantage with children with Down syndrome is the research is there, so we can be prepared. So children with Down syndrome, 50% of children with Down syndrome can have heart problems, and 50% of those will need surgery to fix the heart problem. The other physical issues are normal coughs and colds and ear infections and chest infections. All these things take longer to recover sometimes. Down syndrome, children with Down syndrome and adults have low tone, hypotonia, low tone. So a little bit more floppy. This low tone is also inside the body. So the lungs, the airways, your bowel. So because of the low tone in the bowel, more likely to become constipated and have constipation issues. Because of the low tone in the chest and the airways, coughing up the sputum and the chest infection is harder. In the ears, the angle of the ear canal is more shallow. Because of the shallowness, it's harder for all this muck to come out. So that's why it takes longer to recover. So there are some physical health conditions which are more common in people with Down syndrome. However, because of medicine advances, we are able to manage many of these conditions much better. Consequently, these children with Down syndrome are now outliving their parents, which is wonderful. Compared to 1980s, when the life expectancy for people with Down syndrome was 15-20 years, now there are people with Down syndrome who are in their 50s, 60s and 70s. So this is demonstrating the advances in medicine to help the health conditions for people with Down syndrome. So inclusivity is very important. That not just people with Down syndrome, anyone who is a bit different, anyone with some differences, and even people who are neurotypical, who have no issues. Loneliness is a very, very big and common issue around the world. Inclusivity is trying to combat the loneliness. Inclusivity is not complicated. You just have to think about it. If you are building a building, please make a ramp rather than the stair. So someone who is less able to walk, in a wheelchair, in a buggy or a stroller, or just can't walk very well, the ramp with the handrails is much easier than trying to navigate the stairs. Children in a playground, ask them, can I play with you? I want to play with you. How do I play with you? Raising awareness is taking away the fear. People don't know how to talk to people with Down syndrome or other people with differences. So we are trying to bring together, come together by being inclusive. So inclusivity, very simple. Here in Maarga, there are ramps all the way up to the 4th floor, having lifts everywhere. These are helping physical inclusivity. Verbally, communication, if you are sending any leaflet, send it size 18 font, big and bold, easy to read information, easy to understand information. So lots of ways to make it inclusive, not just for children with Down syndrome, but adults with Down syndrome and people, anyone who has a learning difficulty or a learning disability. And the most important thing about inclusivity is it does not exclude neurotypical children and adults, okay? So by making the ramp, everyone can use it. So people who can walk will still use the ramp. If you are playing a game that is inclusive for children who have Down syndrome, the children without Down syndrome will also enjoy the game. So inclusivity is not just for people with extra or additional needs. Inclusivity is for the whole world and for everyone with all abilities. There are many doctors, clinicians and therapists who have specialized in learning disabilities and specifically Down syndrome. Here in India, there is a very, very useful website created by Mohan Agarwal called Inspiring Pathways. This has therapies from all over India for Down syndrome, but also for any other conditions where learning is an issue. Now, finding the right person, whether it's therapy, whether it's physician, whether it's a doctor in different situations, there are many doctors, like I said, who have specialized in this. So you can get word of mouth recommendations or do your own research to try and find someone. The most important thing is, as a doctor, to remember the parents know their child best. The family knows the person best. So when someone with Down syndrome has a chest infection, they might actually present with tummy pain. So it's understanding as clinicians about diagnostic overshadowing, which means we see the label Down syndrome and we forget everything else. We blame everything physical and mental on the Down syndrome and we forget how to diagnose. So that is the important thing to remember. So to all people who have Down syndrome and parents of children with Down syndrome, family members, extended family, anyone who knows anyone with Down syndrome, my message is that, so Dexter has made our lives better. Having a member of your family with Down syndrome is a good thing and it'll enrich your lives. We have moved from England to India because of Dexter. Our lives are more extraordinary, are more exciting, and more adventurous because of our son who has Down syndrome. So we are grateful and thankful for his extra chromosome.